All right, we are live. Good morning, good afternoon, good evening, AFWO family. It's been a minute, but today I have a special AFWO Speaks here, and it involves the membership. I have a member here that is willing to have a conversation about a mental health issue that she has, and hopefully it'll be relatable to y'all. But in the meantime, Air Force Wingman Outreach at gmail.com is where you can reach out to us for anything, any type of anonymous situations or stories that you want any answers to. We will post them as the admin and make it to where we rally around each other as always. So please either do that, or you can go to the top of the page in Facebook and go to the membership, and you can see all the admins and moderators in our group. So without further ado, we'll introduce our special guest, and her name is Kristen. Thanks for coming on, Kristen. I appreciate it.
Yeah, thank you for having me.
Hey, no problem. So let's just I want to kind of get a background in it to our membership. Basically, what I did is, I think I was going through some posts, and I normally see anything that appeals to me. And somebody was asking about depression or something for a certain, I don't know if it was a project or just for a question. And you were like the one person that responded to it and felt like, hey, ask away. And so for me, that drove me to say, you know what, is she willing, he or she willing to, have a live discussion about this? And so I appreciate you being willing to engage, first of all. To me, I think it takes a lot of courage to really be public about it. But you sound pretty comfortable in your skin. So I'm hoping that this gives some sort of encouragement to people. Our membership, our 36.6 other members, to really just be outward with it. Like, there is no shame in it. So without further ado, kind of give us the background yourself.
So I am a Korean linguist. I've been in for almost 5 years. It'll be 5 years towards the end of this year. And it's been a rough road for sure. I've been through a lot in my time in the Air Force, and I've enjoyed it. I've hated it. I've wanted to go the full 20, and I wanted to get out as soon as possible. I've been on every side of the spectrum. And I wasn't diagnosed properly with depression until it got to a point where I was ready to commit suicide, and I was hospitalized. Thanks to my husband. He really kept an eye out for me. And after that, I was finally able to get the help that I needed. A lot of people weren't able to see the signs until it was almost too late. And part of that is kind of, I don't want to say my fault, but I was always really good at putting on a mask and looking happy at the office and not talking about my problems. So I thought it would be a good idea to be more open from then on.
So how long have you been dealing with, depression is what you're dealing with, right?
Yes, ma'am.
And how long have you been dealing with that?
Pretty much since I started tech school. I was in an abusive relationship at that point, and it devolved to a point where I was back and forth between like extreme happiness and feeling like I wanted to die. And I tried to go to mental health services, but in tech school, it's really hard to do on a regular basis.
I got you. And so when did you said you start, like you knew you had it. Is that what you're saying? You knew you had it, and because of the time frame that you were in, like you were in tech school, were you more concerned about just trying to get through, to get to your first base?
Yes, I was very much hoping that, it was just the stress of tech school that was causing that, because I was going to DLI, learning Korean. If they say it's the fire hose method, they mean it. Mm-hmm. And so I thought that maybe it was the stress. And then I got to my first duty station, and it didn't go away. And that sort of led me to start believing like, okay, maybe I should look into getting some help. And I started seeing behavioral health, and they were pretty good for the most part, but it just wasn't enough. And then I also had several other health issues, like physical health issues, come into play, and those exacerbated the depression.
Okay, so kind of give us a look into like what depression looks like now. I've seen a lot of things, or we societal may see depression as your typical I can't get out of bed, woe is me. Is that accurate, or kind of paint a picture for us what that looks like for you?
So that can be accurate at times. I've definitely had days where I just felt like I could not get out of bed. I would just lay in bed on my phone, scrolling through Facebook, TikTok, YouTube, whatever, and it was mindless. I wasn't paying attention to what I was seeing, but I had no urge to get out of bed. I had no urge to cook or to play with my animals or to paint, which is something that I really enjoy and I've enjoyed my entire life. And I just lost all interest in those things. I would just kind of mope around the house, and occasionally I would get tired of that and I would go on a cleaning spree, or I would like make a goal to play with my birds every day for a certain amount of time to like bond with them, or I would try to study something or paint a certain picture, etc. And then that motivation would quickly go away and I'd be back down into depression.
So, how much of would you say that your depression was in two phases? Like, would you go to work and you be yourself, or would it still be would you be depressed still?
At work, I very much put on a face because I didn't want to drag others down. I tried to be the optimistic, peppy kind of person that everyone could look to and could ask for help or ask me to run errands or do taskers, things like that. Um, After a while, I kind of ended up shutting myself out, and I was in the back of the office working nights, not talking to anybody. I All of my friends that I had when I first got here PCS or left the Air Force, etc. And I had no desire to try and make new friends. So I just ended up pushing loneliness onto myself.
So, did you still, when you say pushing loneliness on yourself, you know, what did that lead to?
That led to me getting to the point where I did want to commit suicide. And along with the physical health issues that I had, I was getting to a point where I would look at my bottles of medication and think, maybe I could just take these and nobody's here to even notice if something happens. And that was a very scary thought. And I told my husband about that, and that's when I was able to finally get the treatment that I really needed. Um, it did take a big scare, and it scared not only me or my husband, but it scared my behavioral health team and my command as well. And I remember them commenting that they really had no idea because I was always so perky at work. Um, and eventually I just couldn't hold up that mask anymore.
And so now you take the mask off, right? Do you
Yes,
feel, do you feel better, or do you feel like, oh, you know what, I can be me?
I do. Along with medication, as well as therapy, both physical and mental therapy, and moving work centers and talking to people and having my husband advocate for me with the first sergeant and the commander. A lot of things have changed in my situation, and I am able to do art again. I'm able to take care of my house and my pets and everything that needs to be taken care of. I do still have bad days, and on those days, I usually won't talk to anyone. or I will, call out sick. And I try not to do that, but sometimes you just need a mental health day and you need to rest.
So you're saying you take a day of leave or something
Hmm.
and you regroup.
Yes.
And so when you regroup, what is that like? Doing things you enjoy, or is it just needing to sleep? Is it just kind of feeling what you feel, or what?
Um, Sometimes it really depends. If I miss a day of my medication, then a lot of times I will take that day to wallow in self pity, which isn't a good thing,
Right.
but um, usually that does kick me into gear to get back on my medication and do things properly. Um, if it's just a bad day, regardless of whether I skipped or not, then I do take that day to cuddle with my kitties or sleep or do therapeutic art. Um, a lot of times I have to be less serious with the things that I enjoy. Like sometimes I take them too seriously. And so on those bad mental health days, I need to let go and just do what flows.
So do you when the medication piece of it, did you have any hesitation about that at first?
I did. I was worried that it would change me as a person and make me like numb and kind of robotic. I've seen how it could do that to some other people that I've known with ADHD or bipolar disorder, things like that, and I didn't know how it would affect me. Um, it did numb me at first, and I did feel like a robot for a couple of weeks, but once I was acclimated to it, then I started feeling much more like my old self. And it was a very noticeable difference to friends and family.
So in your mind, I imagine your hesitation was just because of the fact that, medication associated with mental health is
Mhm.
normally, I don't think it's as acceptable as say when you take medication for a headache, right?
Right.
So, we could take a million Motrin, no problem for
Mhm.
headaches, a million headaches. But the medication for the mental health is kind of where you kind of like draw the line. But now you feel like, okay, you know what? It's a part of my existence. It's a part of my routine. Like I know that it makes me feel like me.
Yes, exactly. There's this stigma around it where, like, instead of taking meds, maybe you should go running outside or, get a dog, something like that. And that's not the case. Like, it's not. Mental illness is a disease of the brain, which is an organ. It's no different than if you have asthma or if you have, like, a kidney infection. Sometimes you need medication for it.
Mm. So what would you say has been the most important part of your journey? Just like it's not a curable thing. It's not a cure per se. You know what I mean? But what has made you, aside from the medication, help you maintain like what it is that, just being alive, being here.
It's definitely the support of not only my husband, but my friends around me, my command, and knowing that they're there for me, and the fact that they have helped me through not only the depression, but through the med board cycle and various other things that I've been going through as well. It's all about the support.
And so you say your command was very supportive.
Yes.
And do you mind elaborating in what way?
So, my previous supervisor, before I promoted, he reached out to me and he asked if he could keep checking in on me, not as a supervisor, but as a friend. And my commander and my first sergeant have also been very like aware of my situation and what's been going on with my mental health state at my office. And so they were the ones who helped to get me a new job in a better environment that allowed me to be more social and to have access to like my phone, because working as a Korean linguist, we couldn't have our phones.
Mm.
And that has helped me open up as well.
Okay, so they have helped you adjust, like they have
Mhm.
adjusted certain things in order to meet your need.
Correct. Yes.
Okay, that is awesome. That is awesome.
Mhm.
And I like to hear those stories just because it could give a lot of us, some sort of motivation or an incentive to feel like it's okay to do it because not every situation is bad,
Correct. Yes.
right? So, has have you felt like have you kind of felt like the odd person, or you still feel a part of, your organization?
When I was in the lowest point of my depression, I absolutely felt like I was the odd one out, and that, even if people were talking around me, I felt like I couldn't join in their conversations. I felt like a complete outsider. But now that I've moved locations and I'm on regular medication and I'm going to therapy, I do very much feel like I am able to get along with everyone and fit in and share stories. And I'm also able to help out others who have been going through similar things. And that's been very meaningful for me.
Okay. Okay. So you have been able to do outreach for others in these same situations.
Mhm.
What is something that you think, what do you think is for people, or for people who they like, hey, I think I have depression, or maybe the signs are there, like, what is something you think they should try, or what did you learn from this experience?
I think the biggest thing is don't be afraid to tell your supervisor how you're feeling. It might feel like they have to have some kind of wall there, like they can't take care of you in that respect, but they really can and they will. Um, for example, my husband is a supervisor to several people, a few of whom also have depression or anxiety or other issues, and he will go to their house at a drop of a hat if he needs to. My previous supervisor would do the same for me. Absolutely do not hide how you're feeling from your command. They will help you.
And I also want to note to those who are watching that you can ask Kristen questions or leave your comments. She will answer those. She is very willing, and as you can tell, she's comfortable in her skin. And so, what this page is intended to be is a resource, but also to bring members like her to this platform to where we can really do the outreach that this page is willing to seek. So, please ask your questions. Please leave your comments, whatever it is. We'll ask her right here. But the conversation we're having is about depression, and has experienced it for how many years? Your whole career?
Just about, yes.
Okay, and how many years is that?
About 4.5 years.
About 4.5 years. So you had just started your Air Force career, and that's when she experienced that. And so 4 years later, you're getting all the help that you need, and you're still, you said you went through a med board process too.
I'm still going through
You're
it.
still going through it. And
Yes.
so how long has that been for that?
That's been for the past 6 months.
Okay, gotcha. And what has that experience been like for you?
It's been kind of a relief and stressful at the same time. The med board process is for my physical health issues, and I will be most likely getting discharged, which is something that I've accepted, and I'm perfectly okay with it.
But it's not for your mental.
Correct.
Okay, okay. Just want to make that clear.
Mm-hmm.
Okay. So what do you worry about the future, or do you worry about with your mental health issue, how are you going to exist somewhere else or be able to function? Does that kind of cross your mind?
So it actually has, but I also consider myself very lucky. My husband, once he separates from the Air Force, is going to be a civilian contractor. And in the meantime, I will be going to art school.
Okay.
And I plan on becoming a comic artist.
Exciting, exciting. What a happy ending it sounds like. And it sounds like your husband is your biggest supporter.
Oh, he really is. He's
Is
amazing.
I think that it's pretty awesome. So I mean, So I guess it's does do your support system, like, do your friends know of your condition? Are they acting any different, or are they just as supportive of you?
So my friends have always been supportive, and they haven't started treating me any differently. They don't feel like they need to walk on eggshells around me. For a while, my parents felt like they needed to be careful, and they were very scared that my diagnosis would be very negative for my career, for my future. But through education and seeing my improvement, they have gotten to a point where they can treat me like they always have without any issue.
Awesome. So what do you think it took? Took some educating, it took some
Mhm.
patience,
Yeah.
right? Because I imagine that they, like some of us, see depression as one way versus it can have very different looks, right?
Right. One of the things that they were worried about is the stigma with depression in social situations, or say with, um, they were worried that it would prevent me from, say, buying a gun or like getting a motorcycle license, things like that. But that's not necessarily the case.
Mm,
And it's also just a person by person basis. Like, I don't really want a gun, and I might get something other than a motorcycle, even though they like to ride.
right. I see. So what inspires you to keep living? Because obviously you did have a suicide attempt, but now you're in a different place. Like what do you think pulled you out of that space and is making you feel like, what, I can do this?
It had a lot to do with my husband's support, of course, and being able to take a step back. When I was hospitalized, I didn't have my normal duties to worry about. I was able to just focus on me for a while, and I was able to get a lot of my emotions out through painting and getting a good cry in here and there,
Mm.
and just relaxing, doing puzzles, reading. And that self-reflection was a big contributor to pulling me out of my darkest moments.
Self-reflection. Can you elaborate on that? What did that look like?
So we did art therapy in the hospital, and that allowed me to think about who supports me, why they support me, and what they mean to me. So, for example, one thing that we painted was a tree of life, and I was the trunk. My parents were the roots, and my husband was the leaves. And that was kind of my way of saying that, like, he provides me sunlight and nutrition, basically, and my parents provide me the nutrients from the soil and growth and all of that. And that was able to get me thinking about all of the good things that I have in my life, the things that are worth living for.
So that is, this was inpatient or outpatient?
Inpatient, yes. I stayed in the hospital for about a week.
Okay, so let's talk about that,
Hmm.
because I think that, because that's ultimately a voluntary thing.
Yes.
And so I know that some people hesitate because they hear inpatient and probably immediately think they're going to lock me up somewhere in a padded room. But can you kind of share what your inpatient experience was like?
Absolutely. I was pretty scared about it myself. I was scared that I was going to be, in there with, a straitjacket, or, being put on a bunch of different meds and just like drugged up the entire time. But that absolutely was not the case. They checked me in. They made sure that I didn't have anything dangerous on me. I was allowed to keep my like a piece of paper with important phone numbers on it, so like my command, my husband, my parents, etc. And I could have books, and they put me in some pajamas, and I wore those throughout the week. Changed every morning. They gave us fresh pajamas and fresh socks. Um, and I was at 7 West over at Walter Reed. They woke us up at about 6:30, I think that was, and we would go get our vitals checked by a nurse. They would take our weight, take our blood pressure, etc., and then we would get breakfast, and we basically spent the morning relaxing, watching TV or movies, reading books, doing puzzles, drawing, and then we would go to classes throughout the day. So art therapy, group therapy, cognitive behavioral therapy, just lots of different therapies. And we would get free time to work out, to read more, call family, friends, etc. And then lunch and dinner. And at the end of every day, we would sit in the common room and everyone would say a thing that they accomplished during the day and how their mood was. And every morning we would talk about a goal for the day. So if we met that goal, then we would, do a little celebration, like, yes, I made it.
That's awesome. And so was it was it I can imagine that it felt kind of freeing a little bit because ultimately you were not in your organization. You were just focused on yourself and what you needed to deal with. And, you weren't necessarily concerned. Like there was, you could just work on yourself.
Exactly. I didn't have to worry about food. Like we did have to order our lunches every day, or all of our meals, not just the lunches.
Sure.
But even if we forgot to do that, we still got fed, of course.
Right.
So we never had to worry about anything like that. We didn't have to worry about, our job, our mission. We knew that stuff was getting taken care of. And while we were there, we had no responsibilities except to be present.
Mm. And from when you started versus when you left, difference.
100%.
In what way?
When I was going in, I was basically ready to commit suicide. I wanted out. And by the time I was out, I had done a lot of self-reflection. And my biggest thing was that I want to get better. I want to live and I want to thrive. And that's how my thinking was able to change. And it's still a process. It's definitely not an overnight thing, but it was a big help.
Okay, I got you. So then you left inpatient, and it was only for a week, and then you went back to your organization. And was it kind of awkward, or was it just like, "Hey, welcome back"?
It was mostly just welcome back. I did talk with my flight leadership and my squadron leadership a lot more, but they weren't super open about everything. They didn't go and tell everybody where I was or why. And so nobody really,
Nobody knew.
yeah.
And I think that is one of the bigger things that is a fear,
Mhm.
is that it's like you have the label on your chest somewhere, and really it's only your command and you and the people in your life that you want to know this, right?
Exactly. Yes,
Okay. And so you kind of feel a little bit relieved because it wasn't publicized.
exactly.
Okay. Okay. And so how long ago was that you went to inpatient?
That was December of last year.
Okay. Okay. And so you've used those, the inpatient gave you tools to use. And then now you're going you when you I imagine when you left inpatient, you went to the base mental health. You continued treatment there.
Yes. After you go inpatient, then the behavioral health clinic, whoever it is that you see regularly, has to check in and see you face to face at least once a week for, I think, 60 days.
Mm-hmm.
Just to do a basic safety check. They make sure that you don't have any access to weapons or any other ways that you might hurt yourself. And then they can decide from there whether you're good to wean off to once every 2 weeks or once a month, etc. It just is a case by case basis.
Okay. Wow. So from tech school to now here, went inpatient, got out of it, to mental health treatment,
Mhm.
still continuing that, I imagine,
Yes,
but very much in a better place than what you were.
absolutely.
Okay. So, last thing,
Mhm.
what is your, what have you learned in this experience, and do you have any advice or anything that you would want to know if somebody was going through your situation?
I think the biggest piece of advice is to find your support system. If you feel alone and like you don't have one, reach out to your first sergeant. At the very least, they will be on your side. And a lot of people who you think would stigmatize you and look down on you about it probably won't. Like, I was very afraid to tell my parents what was going on because they grew up very against medical procedures if you could avoid it at any cost. But after telling them, it really opened up a dialogue between us, and I was able to be a lot more open. Um, so that's a big thing. It's like, don't assume what people are going to say to you about your depression or anxiety or whatever it is that you might be dealing with.
Mm. And it sounds like the people that are closest to you, if you can be real with them, I imagine that will lift some weight off of you, right?
Yes, 100%.
Wow. Well, first, I thank you for sharing with us
Yeah.
all of this. Like, this is, I love hearing stuff like this because, there is light on the other side, right?
Hmm.
Obviously, we know that it's a continuous process that you're going through, but the fact that you're still here, is the most important thing. And that you did a suicidal attempt, but you made it through. Like, you made it to where you realize that life is a lot more living, right?
Yes, ma'am.
Okay, so yeah, that concludes this interview. And again, Air Force Wingman Outreach at gmail.com is the email that you can reach out to. This episode will be on the Facebook Live. I'm going to pin it to the top of the page. It's only 30 something minutes of your time. Members, AFWO family, I need you to come back and watch this. I need you to leave Kristen some comments, some questions, words of encouragement, because honestly, we are really extremely proud of her for making this journey and being able to give it to us the way that she has dealt with it. So thank you, Kristen. Thank AFWO family, and we appreciate it. We are out.
Thank you.